Welcome everyone. So today we have Lauren Herman with us. She has extensive experience in helping students overcome communication challenges when it comes to the US healthcare system. So we want to get her perspective on the issues and challenges she has seen that IMGs face as they navigate their way through the US healthcare system. Now, whether it is reaching out to the programs over email or over a phone call, or dealing with the patients, interacting with the patients, or even interacting with the attendings and other team players. What are these challenges that the IMGs face, and how can they overcome these communication challenges? So she's going to talk about all of that. Then she's also going to talk about the OET exam. So now, of course, the CS has been canceled. So we'll get some tips on OET and how IMGs can prepare for it. She's going to be starting a new course for USMLE Sarthi focused on this exact topic, the communication challenges that IMGs face, and how this course will help improve your communication and accent related issues when it comes to the US healthcare setting. So, without further ado, let's see what she has to say about the communication issues and tips to improve some of those barriers that you may face. So, welcome, Lauren. Glad to have you here. And before we start, why don't we talk a bit about your background and how you've been helping improve communication skills in the healthcare setting?
Absolutely. So I earned my Master's of Science degree in Communication Sciences and Disorders in 2012. And I started my work at a skilled nursing facility. And then throughout my time since 2012, I've worked across various healthcare settings, from skilled nursing facility to the acute care, outpatient rehab, inpatient rehab, as well as private practice. So I have a lot of experience helping individuals really across the lifespan, because even the NICU I've worked in. So individuals across the lifespan with their speech and their communication skills, particularly within the healthcare setting.
Thank you. So now let's dive deeper into our topic for the day and how you will be teaching that course. So, what exactly are the communication and language skills that IMGs need as part of their residency journey in the US? So, can you talk a bit about these skills?
Absolutely. Well, I like to start out first by pointing out that communication and language are actually two separate things, and they both can cause communication and linguistic breakdowns. So, language is, of course, just the words and the grammatical structures to help you communicate a message, to convey that message. And then communication is how you express the language. So, that could be through written modality, spoken modality, as well as non-linguistic features. So your facial expressions or the tone of your voice, your body language, all of those can really carry a pretty strong message. Now, when it comes to the medical fields, communication and language is crucial to best patient outcomes. And especially in the United States, we really hold language and communication skills to an incredibly high standard, to the point where that can impact patient salary and hospital reimbursements through patient satisfaction surveys that a lot of hospitals are required to send out to their patients. And they have to actually rate how well they felt like their medical providers communicated that complex information. So the communication and language skills that you will need in your journey to US residency as an IMG, it includes a lot of things. First, a lot of people think of speech clarity, and that could include the non-native accents that can impact your speech clarity, your speaking rates, just the sounds that come out when you're expressing the language, the rhythm of your speech. Also, your nonverbal skills. So, like I was mentioning earlier, your facial expressions, your body language, the tone of your voice, the rhythm, your ability to demonstrate patient empathy. That's something that you need in your journey throughout your US residency, as well as how you interact with your department, as well as interdisciplinary members across the healthcare continuum. You also need to understand how to successfully write emails or leave voicemails. And one of the most important skills that you'll need throughout your US residency journey is how to explain complex diagnoses or procedures, having those tough communications, those tough conversations with your patients and their family members, and really explaining just the decision making process throughout the healthcare continuum.
Yep, yep. And even before they get there, as part of the interviewing for a position in the residency match, of course, communication skills are important for the interviewing process as well.
Yes. Yep. Yeah. The communication skills absolutely are incredibly important for that.
Yeah, yeah. And as NRMP data shows, the program directors rate it very high, 4.8 over 5 as part of the interview process. So it is important. Now, what are the difficulties that you've seen an average IMG facing while interacting with patients in the US? And how is the course that you're going to teach? How will that help them overcome these challenges or these difficulties?
Well, there are actually three themes that have surfaced as challenges for IMGs when it comes to interacting with patients in the US. And those three themes are patient centered care, cultural sensitivity, and patient interviewing. And those are three themes that we will really cover throughout the course that I'm offering. The US is becoming increasingly diverse. And while the US model of healthcare is very much patient centered, we
Mhm.
still need to be really cognizant of how cultural and religious differences impact the decision making, the healthcare decision making. And that's something we need to really be aware of because that can really vary just across the cultural and religious differences. One difficulty that an average IMG will face while interacting with US patients in the US is understanding how those religious and cultural differences can impact the healthcare decision making process. So, for example, if you are in Wyoming, you might be more likely to have patients that are Jehovah's Witnesses.
Mhm.
And Jehovah's Witnesses, they will refuse all blood products because they believe that it's against God's will. And Mormons, for example, so if you're in Utah, you might be more likely to be having or be working with patients who are Mormons. They're less likely to accept drugs or medication that might contain caffeine or alcohol. And these are things to be very cognizant of and really helping to support their decision making process. So, in order to meet patient centered care and cultural sensitivity, you need to have really strong patient interviewing skills, which again will vary based on cultural and religious backgrounds. So, again, some family members or some patients will require that family members be present or that the family members make the decision, whereas others might require that the family members not know anything about their medical background and they make the decision. And these are really important things to understand that can be really challenging as an IMG. So there are steps that you can take to build trust of a patient during your interview process, and this course will definitely help you to build those skills. So this course will provide mock patient interviews and training centered on the US healthcare model to help you reach those goals.
Okay. And then, of course, the other question we typically get is, I've been watching a lot of American shows, maybe movies. I'm already interacting with the population in general, with the US. So how's this course different from that kind of self-learning, and how much time before I actually see improvement after I take this course, or as I'm in the course? So basically, when will I start to see the improvement? So two questions, I guess.
Yes, I hear those questions all the time, actually. So this course is very different from self-learning by interacting with American people or watching American television shows, in that each program is tailored specifically to your accent and speech clarity needs. It's interactive with a medical focus, and the information is realistic and directly applicable to your work as a physician in the US. The problem with television shows, especially medically based television shows, is that they don't demonstrate realistic scenarios. And honestly, if you were to mimic or model your communication skills or your response to certain situations based off of television shows, in reality, you're more likely to get fired or sued. So we want to avoid that.
Right.
And I'd also like to add that there are limitations with learning from YouTube. There are definitely helpful YouTube videos out there. I learn a lot from YouTube. However, when it comes to language and communication skills, especially those non-linguistic skills, like I was saying earlier with facial expression and body language, YouTube creators, while they might have great information, they can't hold you accountable or directly provide you with feedback when you go to implement those lessons in the real world or in a mock setting. Limitations with simply relying on your interactions with American people is that should you demonstrate a communication blunder or make someone maybe feel a little uncomfortable, the person you're speaking with will likely not redirect you in a constructive manner by pointing out those soft skills, so your interpersonal skills or non-linguistic skills that you need to improve, because they might feel that it's impolite to point that out in a conversational setting. So
Right.
when you invest in a small course that's dedicated to highlighting the do's and don'ts of communication in a medical setting, then the lessons are clear and the goal is to be directly supportive of strengthening your communication skills in a safe and effective environment. So as for the amount of time that you'll need before you see any improvements, because I do get that question a lot, it really depends on how much time you actually dedicate yourself to the work. If you simply show up to each class and only dedicate your energy to learning and improving during those 90 minutes twice a week, then you will see improvement, but it's going to be minimal and it's
Mhm.
going to be slower progress. But if you take each lesson and then create a schedule that includes daily practice, then you will absolutely see greater progress at a much faster speed. So I've personally worked with individuals who have noticed significant improvements in their speech and communication clarity after just 3 sessions, but they were completing their home exercises and carryover practice every single day. They were dedicated. And at the same time, I've worked with others who really never put in the effort beyond just our one-on-one time together once or twice a week. And they saw improvement, but they didn't really get as much value out of it. It took longer. So just like with any course you take, you'll see the greater growth at a faster rate the more you practice. So it's the whole principle of neuroplasticity.
So the other question we get is, do program directors really consider communication as an important issue, although there are surveys out there? And then second, some specific examples that you may have seen of poorer communication, language issues that land IMGs in some problem or trouble.
Oh, yeah. So with do program directors really consider communication as an important issue among IMGs? Absolutely. And in fact, in one article that was published from the Association of Program Directors in Internal Medicine, they noted that differences in accent and communication styles do interfere with optimal patient care. And the article actually states, there's a statement in there that says, accent modification is a major focus of communication training programs in the medical setting, and intonation and its effects on healthcare provider patient relationships, it is paramount. So misinterpretation of the intent or of critical information may have life-threatening and potentially legal ramifications. So clear pronunciation will also have a direct effect on your ability to state medical information accurately. And some examples of communication breakdowns as a result of stress and intonation differences or differences in your accent and speech clarity include numbers. I see in here a lot with numbers because of the stress and intonation. And a great example of that is 15 versus 50. So 15 milligrams of a medication might be fine, but 50 milligrams of that same medication could be lethal.
Right.
And those, I have seen those situations actually happen personally. I've worked across 8 hospitals now across the country, and I have seen those situations actually happen when maybe an IMG is doing a phone order to pharmacy And so the problem with talking on the phone, of course, is you can't see the person's lips, you can't see their body language. You just have to rely on what your ears hear over the phone. And 50, 15, it's the difference is it's a small difference, but it can have a huge outcome. So it's things like that that can be crucial in the healthcare system. Also, how we differentiate nouns from verbs. So
Mhm.
like progress versus progress. Two different meanings, same word, but one syllable is stressed in a different way among those two words. Totally different meaning. So these little nuances that have a huge meaning, these are things that we'll focus on in our class. And now examples of pronunciation with accent differences having a direct effect on the ability to accurately state medical information include, I commonly hear the R versus L sounds that we might see often with native Chinese speakers, such as bleeding versus breathing,
Mhm.
or the D versus the voiced TH sound. So da versus v that we might see with IMGs from India. So breathing versus breeding. So in the case of the 15 milligrams versus 50 milligrams communication breakdown, that can lead to a lethal consequence. If an IMG is providing a verbal order over the phone, like I mentioned earlier, and then the breathing versus breeding, that can cause a lot of communication, or even some patients could even take offense if they hear the wrong thing.
Yep, yep, yep. So continuing on the differences, many of our students who maybe are coming here for the first time or may not even have visited the US, what are the differences in the physician-patient communication in the US healthcare system? Now, of course, you may not be that familiar with the Indian healthcare system, but just from a US healthcare system. Many students want to know what are the differences as opposed to what they are used to maybe back home in India or elsewhere.
Sure. The biggest difference that I've seen and even have discussed with other nurses, other healthcare professionals from particularly India, is just here in the US, observing that the physician-patient communication here is patient-centric versus provider-centric. So we focus on the patient instead of the provider. So what this means is that the questions that you will ask as the provider will focus on the patient's goals and the patient's preferences, and recommendations made by physicians will fit the patient's preferences, even if the patient's preferences don't actually fix the problem. For example, through the patient interview, you might find that the patient doesn't want to have a feeding tube at all. And that's something that I actually come across a lot as a speech pathologist working with swallowing impairments, is we might recommend a feeding tube, but there might be patients who just don't want a feeding tube, despite the fact that it could very well prolong their life by years. And instead of encouraging a feeding tube or pushing a feeding tube, because that is provider centric, that that's medically what will work, or other interventions that might provide longevity, the physician patient communication in the US will shift to focus on how to meet those patients' wishes.
Mm.
So it could, and often does, include team discussions, appropriate referrals, so maybe to palliative care or hospice. If the patient decides that they'd rather eat and drink, maybe it's unsafe for them, they're high risk for aspirating, developing pneumonia, they don't care. They still want to eat their food and drink their liquids. So then we look at how to communicate with other professionals to help support their goals, knowing that it's dangerous. Knowing how to discuss end of life care and shifting the focus to comfort or palliative care to allow that patient to pass away with dignity is important too in the US healthcare system. So patient-centric communication also requires a lot of patient education using language that's really simple for the patient and their family members to understand. So for example, instead of telling the patient that they have strictures in their esophagus, causing them to eventually aspirate food and liquid, you would find simpler terms that the patient could understand and try to include maybe even visuals or hand gestures to help show that patient what you mean. So instead, you could say that part of their food tube is tight and narrow, making it difficult for food to pass down into their stomach. And instead, it builds up into their throat and spills into the airway in their lungs, which is risky. So that will help the patient and family members to really understand what's going on. And that's really important in the US healthcare model. The patient-centered communication model really fits the idea that patients are not coming to you for surgery. They're not coming to you for pills. They're coming to you for a solution to their problems or options to help them meet their goals, even if their goal is to stop all life-prolonging measures. And finally, access to healthcare is much easier across all income levels in the US than, from what I've heard, it is in India. So, meaning that much of the physician provider communication will also take the patient's income or lack thereof into consideration. In certain parts of the country, working with patients who are homeless is actually quite common. And this requires more detailed conversations around post discharge care, sometimes requiring the assistance of social workers and community service providers, because we may not be able, we can't discharge these patients back onto the streets. We have to have a discharge plan in place. And so that's something that I've heard is a pretty big difference.
Yep, yep, yep. So now let's talk about the logistics of the course and how exactly are we going to run it. So can you talk a bit about that aspect of the course?
Sure. So the course consists of small group sessions that will meet online twice a week for 6 weeks, and each class lasts 90 minutes. Before our first session, each student will receive instructions in their email to complete a recording of themselves reading medical terminology, phrases, and paragraphs that they'll then send back to me so that I can complete their individualized speech analysis. This will then help me to actually tailor the program to focus on the greatest accent and speech clarity needs of the class. And approximately 50% of the course is dedicated to accent and speech clarity, whereas the rest of the course is dedicated to communication skills in the healthcare setting. So while the course will primarily focus on spoken communication across various situations like interviewing, networking, interviews, etc., there will actually be some focus on written communication as well. So email. I will provide mock patient interviews or patient provider interviews for the students to analyze. And there will be home assignments that will be provided for ongoing practice for the skills learned in each class. Each member will also have access to a private Facebook group for IMGs and other international medical professionals, where additional videos and discussions can be found for ongoing supports. If anyone has questions, they can just post it right there. So it's another way to access me as well.
Yeah. And finally, of course, the big question, the OET, because the CS has been canceled and now everyone needs to be certified and take the OET exam. So how will this course help them in the OET preparation?
So this course incorporates annotated role play and sample letters specifically put together with OET in mind. Test tips that mirror the official advice of OET will be provided, and the course will help to familiarize the candidates with the test format and criteria, and also with medical topics, grammatical structure, and lexicon that typically appear in OET. So information from OET preparation material is actually woven into each session, and it'll build on each other throughout the duration of the course.
Okay. Well, thank you very much, Lauren. This was very helpful. I'm sure students have gained a lot from this in order to understand what are some of the challenges they can expect in communication, how to overcome it, and of course, the course that you are going to be launching. So, very, very helpful. And thank you very much for your time.
Thank you.